I'm a victim of pelvic traumatic stress disorder. I'm sure plenty of women feel the same because who really enjoy pelvic exams? Now, in residency, the hospital I trained at had an initiative to offer PAP exams to any woman who is out of date if she were admitted to the hospital. Basically, it's a cancer detection program. It makes sense, right? So the hospital I trained at tasked the OBGYN residency with performing the exams when ordered by the nurse during an intake screening. And like great punitive residency programs, they assign the task to an off-surface resident, like emergency medicine who happens to be rotating on the OB service. But here's why the image triggered me. Most hospital beds are not set up for pelvic exams, right? They, you can do it on an upside down bedpan, but that's not the most comfortable way, and it's pretty difficult in people with a bit larger bodies. So they had a portable cart that would push through the hospital to the patient's room. You'd have the, instead of laying in the bed, they'd turn sideways, scoot out till their bum's on the padded cart, and it had stirrup arms that stuck up above the top of the cart. You'd have them put that in there, do the pelvic exam, kind of clean everything, reset, go on to the next room. But when you push the cart down the hospital, the stirrups stuck out like caterpillar antenna, and everybody stared at you, knowing exactly what you were pushing and what you were going to go do with it. Now, sometimes you had to go through the hospital lobby, past the cafeteria, all sorts of busy places. And the other residents openly laughed at you because they knew what was going on, and it's residency, right? There's a lot of stuff there. But it was so bad.